A very good morning to the audience who have been viewing this short video on polyendocrine metabolic ovarian syndrome, which is nothing but PMOS. I myself, Dr.M.VIMALA Devi, Assistant Professor of Zoology from Valala College for Women, is going to deliver you a short lecture about the PMOS and its symptoms, causes, and the genetic variants, which has been more prevalent among the reproductive women in this current scenario. And coming to this PMOS, which is nothing but polyendocrine metabolic ovarian syndrome, is a proposed update named after this polycystic ovary syndrome, and it recognizes that the disorder affects not only the ovaries but also the endocrine and metabolic systems. And the reason behind myself to choose this is health is the foundation of a thriving human life for all, for everyone. And reproductive health is a state of complete physical, mental, social well-being related to reproductive system. And in that, infertility is nothing but the failure to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. And this infertility may occur for anyone, like male or female, or by some unexplained factors, and certain factors are curable and most of the factors are non-preventable, but we can at least we can able to manage those factors. If we take this current scenario of PMOS, globally, it affects about 170 million women, that is roughly 1 in 8. And while in our country, India, the burden is much higher, at nearly at the rate of 1 in 5 women is suffering from this syndrome or disorder, and up to 70% of those are being undiagnosed and unrecognized among the illiterate as well as the literate personalities in and around our country. And the reason for the name change from the past, that is PCOS to PMOS, is of focusing several factors, like in the current scenario, according to the American Society for Reproductive Medicine, changing this PCOS to PMOS name accurately reflects the conditions, that is whether it may be metabolic or lifestyle factors, and its symptoms. The goal of the name change is to facilitate the greater awareness, improving the care and outcomes for the 1 in 8 women worldwide who live with the condition. The concern was that here now we are focusing on the cyst contributed to misdiagnosis and delayed treatment in case of PCOS, whereas in PMOS they are concentrating at all the other factors like metabolic factors included in that. When this PMOS emphasizes the condition of polyendocrine and metabolic disorder, PCOS mainly focus on ovarian disorder, and hence the name highlights the importance, PMOS highlights the importance of insulin resistance, hormonal imbalance and metabolic dysfunction, and that's why PCOS has been renamed as PMOS. And there are other factors. There are about some 4 to 5 important factors which is being dealt by the doctors for the causes of PMOS. The doctors are now with broadened care to treat patients with both the reproductive challenges like anovulation and irregular menstrual cycles among the women of reproductive age, and the other core metabolic drivers like insulin resistance, simultaneously to support healthy pregnancies. And this being experts say that the previous name placed too much emphasis on ovarian cysts, which are not present in everyone with this condition, potentially contributing to confusion and delayed diagnosis among the patients. So the new name created awareness, reduced misconceptions, and encourage a more comprehensive approach to care, and that's why experts wanted to move away from PCOS to PMOS. And this broader understanding can lead to a new era in the reproductive treatment among the people. And when you take this history of PCOS, according to Stein Leventhal, in the year 1935, the syndrome has been identified. After Stein and Leventhal associated the disorders like amenorrhea, obesity and hirsutism among the females of reproductive age. And when we take these causes, no exact cause of PCOD or PCOS has been accurately found yet, but there are some certain factors or points to be get correlated, like the patient's family history, that is genetic hereditary wise, or the changes in their lifestyle. That is, lifestyle includes their environmental as well as the dietary habits, and lack of daily routine exercises, changes in dietary habits, loss of work life balance, exposure to environmental pollution, and exposure to mobile phone radiations, and all the other important one of the factor is stress, which is being surrounded by us all over the 24 hours a day. And next, coming to this thyroid disorder, malnutrition, vitamin or iron such deficiencies are also the causes for this PCOS. And if we take this hormonal imbalance, like increased androgen levels, like testosterone, and LH, that is luteinizing hormone, and FSH, that is follicle stimulating hormone, should be in the ratio of 1 is to 1. But if there is an imbalance prevailed, like 3 is to 1 or 2 is to 1, then there may be PCOD preference and irregular ovulation. And these are all some of the genetic and hormonal factors. And while you look into the metabolic factors, the prime factor is related to insulin resistance, hyperinsulinemia, and obesity and metabolic dysfunction. And of course, we have discussed about the lifestyle factors like unhealthy diet, chronic stress, poor sleep, and environmental disorders. And as a result of these causes, the patients may suffer from symptoms like irregular periods or missed periods, infertility, thinning of the hair or hair loss, and acne, then weight gain, especially around the belly, and extra body hair on the areas of chest, stomach, back, insulin resistance, dark or thick skin patches, that is acanthosis nigricans, in the underpits, breast, or on the back of the neck, and oily skin, and also ovary that appears large or polycystic appearance. And looking beyond the reproductive health, that is how this is formation in PMOS or PCOS. That is PCO, that is a condition where ovary of normal woman who is in the age of her reproductive years has a volume of around 4 to 6 ml each ovary has, and have a folded structure like a walnut. But if a woman is diagnosed with PCOS, her ovaries get enlarged and bulky with having more than 10 ml of volume. Thus, it starts producing a high quantity of androgens. And normal ovulating ovaries contain fluid filled sacs like follicles, which may vary in size from 1 to 130 millimeters, and which depends on the phase of the menstrual cycle. So, while in the polycystic ovary, there are more than 12 small follicles, which may be measured from 2 to 9 millimeters in diameter, or usually around a pearl necklace. It resembles like a pearl necklace. So the thing is that the main cause of this cyst formation is being focused only in PCOS, and in PMOS we are being also dealing with other metabolic factors around, especially the insulin resistance in PMOS. This insulin, which is nothing but a vital anabolic hormone produced by the beta cells of the pancreas, which regulates the metabolisms of carbohydrates, fats, and proteins. Often it is described as a key factor, and its primary role is to allow glucose, that is sugar, from our bloodstream to enter the body cells to get energy or stored for later use. And it also plays a critical role in female health, like serving as a key regulator of energy metabolism and a significant modulator of reproduction. So beyond controlling this blood sugar, it also influences insulin also influences menstrual cycles, ovarian androgen production, and fertility. And in that IR, that is insulin resistance, is disrupts these systems, contributing to PCOS, metabolic disorders, and adverse pregnancy outcomes. And this insulin resistance occurs when the body cells stop responding properly to the insulin, so making difficult for glucose to enter the cells to get energy. The body produces more insulin to compensate. Blood sugar level may remain initially, then hormonal imbalance begins silently. And related to diseases like diabetes mellitus type 1, diabetes mellitus type 2. This type 1 type 2 occurs when pancreas being produces little or no insulin, or type 2 in case of type 2 occurs when cells become resistant to insulin effects, that is insulin resistance. So in case of hypoglycemia, excess insulin can cause blood sugar level to drop to dangerously at low levels. And if we take this genetic basis of insulin resistance in PMOS, here INSR gene, which is nothing but insulin receptor gene, which provides instructions for the insulin receptors, and if at all there is a mutation caused, there will be ovarian cyst or high androgen level may prevalent among the women, those who are affected by this. And in case of IRS1 and IRS2, encodes insulin receptor substrates that act as a primary relay team for insulin signaling inside cells, and dysregulation here impairs glucose uptake in muscles and fat tissues. And of course there are other gene factors like THA-DA associated with energy metabolism and increases susceptibility to PMOS, and DEN and DIA increases, as the name implies, androgen production contributes to ovarian dysfunction. And coming to this, can diet improve insulin resistance in man? If you take this type of this dietary management levels, like recommended foods, if you take this, low glycemic index foods can be recommended by the practitioners to the patients, like millets and grains, for example finger millet, brown rice, quinoa, etc. And in case of legumes also we can take like chickpeas, kidney beans, moong dal and lentils. And if we go for lean proteins, we can take tofu, paneer, sprouts in case of plant proteins. And in case of animal proteins, we can go for eggs, skinless chicken, fatty fish, sardine or tuna. And in case of healthy fats, we can go for almonds, walnuts, flax seeds, chia seeds. And fruits and vegetables, we can go for this low GI fruits like berries, apples, pears and papaya. And non-starchy vegetables like spinach, broccoli, methi, that is methi is fenugreek leaves and bitter gourd. And so also while taking care of our diet, we should also limit our sugary drinks, refined carbohydrates, processed foods like burger, etc., and fried foods also. So the very first step in the treatment is the changes in our dietary lifestyle like this. And also we can able to manage our PCOS or PMOS in case, like if we do some worksheets like prevent getting obese or being overweight. We should have weight management and modification in dietary routine by having a low carbohydrate diet, regular physical activity or regular exercise. And we should also modify our behavioral patterns and stress-free life especially. And we should go for reduced intake of fast food and reduced intake of processed food, and also alcoholic beverages we should avoid. And then regular checkup of vitamin D level should be monitored. Then if you take the future perspectives of this, and though we are being in an advanced level of treating infertility like IVF, etc., there are important some future generations like biomarker based diagnostic models should be developed, and more and improve early detection should be done by that. And phenotypic classification, prediction of disease progression through personalized medicine are yet to be practiced in our country in more lengthier lines. And coming to next, investigations into genetic susceptibility and epigenetic influences may help identify individuals at higher risk and reveal novel molecular pathways involved in this disease development and further treatment process, etc. And coming to general awareness to be created among the women of this reproductive age, every year we are being observing menstrual hygienic day on May 28, which combats period poverty and ensures safe sanitation access. International Women's Health Day, which advocates for total bodily anatomy and reproductive freedom. And World IVF of Infertility Day, which goes on July 25th. and which promotes family planning options. And PCOS awareness month is being observed throughout the September month, which will be drive screening for metabolic, hormonal, infertility issues. And all these days should we get awareness create should be awareness about among the women of reproductive age. And the key takeaways from this brief lecture is insulin resistance is an most important part in the infertility stage of PMOS, which is positioned as a central upstream driver with hyperinsulinemia, amplifying ovarian and androgen production. So we have to keep going on our routine work balance and healthy diet, and also proper treatment at the initial stage of PMOS itself. So have a healthy life. Thank you.